I don't think it will be an issue, and if you recall, after they instituted that hard cap, then they gave us another about $3 million
Waiver,
after
right?
that.
Yeah.
Yep, the waiver. But an infusion of 19 additional million, if they allow us to roll that money over
Right.
in successive years, because even as good as we are at this, we would be hard pressed to spend $19 million. But if they allow us to roll that money over as we are enrolling more and more families, that would be a home run for us.
I'm glad to hear that, because hearing 264 families, it's difficult to know. Do we have ballpark figures in terms of typical expenditures per family per year?
Yeah, we're thinking those 264 families would be somewhere between 2 and 3 million of the 19 million, so still leaves us a lot of wiggle room to enroll additional families.
And then what about providers? Like, I know there's kind of a shortage of providers.
Mm-hmm.
Is there spots for, you know?
Well, I think we are right now in the midst of working very closely with our providers to say, hold on for another month, because we're gonna be opening up again. And we are working, you know, we have a close partnership with Child Care Solutions, who assists us in all this work, in literally talking every day to providers, you know, hold on, hold on. The other thing that the county executive is working on is not only the funding side, but the regulatory side. So what are the things that make it very difficult for a provider to stay in business or to open a daycare? You know, some of those things used to be an annual inspection from OCFS. Now it's 4 times a year. And if you're running a business like that, where it's very labor intensive during the day, obviously when folks are working and with children, you know, things like lifting those type of regulatory stresses would be very helpful as far as on the provider side, because to your point, it's not only having the availability of the benefit, it's having a slot for the family. So those are some of the things that we're currently working on, something we've talked about before, reducing that number of absences that every child is allowed, taking it from 80 days a year to a more reasonable number like 30, things like that help both sides of the equation.
Are there any changes like that from the 80 to 30 or anything similar in the governor's proposal?
Not at this point, and that's why we're hoping maybe some of those things could be included in either the Senate or Assembly bill, that then they could get negotiated with the final legislation.
And there's always appears to be a significant lag with payment in some of these things. I remember when CFO Morgan was here, he would talk about the digital versus physical payment, where you're waiting on people to receive checks in the mail from New York State that come months and months.
That we, as the county, are waiting, or the providers are
I
waiting?
forget where that fell in the chain, but I remember that being a major impediment.
And I think that has been addressed and
good.
corrected, yeah.
And I know, I believe Marty implemented this program, but do we have any updates on the capital projects that we undertook with child care facilities in our county?
That wasn't Marty, but he will take
Okay.
credit. He will take credit wherever it's given. No, that was also through social services.
Okay.
They administered that. Again, our partnership with Child Care Solutions provided a certain amount of money where they could make capital improvements to their facilities. We had that as part of, I think, the 24 and 25 budget. 25's money, when the waiting list went to be implemented, I think that was frozen and more dedicated towards being able to keep more families in care.
Sure.
But that was back in 24, and I think over 100 daycare facilities were able to make improvements like playground equipment, other equipment, things on that provider side that helped to keep them in business.
Nice.
Isn't that what happened, Marty?
She can call me though if she does.
Any other questions from committee members? No? All right, Elaine, thank you very much for the update.
Okay,
Appreciate
and
it.
very excited to have you here from the lead team, sitting all behind you.
Yeah.
Thank you.
Yeah. All right, next up we have the health department with a full discussion on lead. Lead also does fall under community development a bit in terms of remediation. They will come up towards the end because they'll transition into our next meeting as well, but predominantly health department discussion.
And really quickly before we start, I just want to make sure, so there's going to be a couple videos we're going to play. There's audio capability in here, correct?
We'll give it a shot.
Great.
All right. Morning, everybody.
If you guys want to introduce yourself, both of you.
Sure. I'm Katie Anderson, Commissioner of the Health Department.
And I'm Jessica Vinciger. I'm one of the deputy commissioners of the health department.
So Jess, our Deputy Commissioner, is and formerly Director of Lead Operations within the county, is going to be going into the various aspects of our programs. But I thought I would just take a moment and just underscore why these programs are so important within the health department and within community development. So lead poisoning prevention is one of the most important public health endeavors that we're undertaking here at the county across multiple departments and across different programs. And the reason for this is because young children in our community and across the country are particularly vulnerable to the effects of lead. Locally, this primarily is in the form of lead paint hazards. And this is because here in the city of Syracuse in particular, but the problem isn't confined just to the city of Syracuse. It's because we, like other cities like Buffalo, Rochester, have an aging housing stock. Lead paint was banned in 1978, and 90% of our houses were built before 1978. And we also have a large density of rental homes here in the city, many of which are well maintained, some of which are aging and falling into disrepair, and children are particularly high risk of exposure to lead paint because they crawl around on the floor, they put paint chips in their mouths, and because of their biology, their brains are particularly vulnerable to the effects of lead poisoning, which can delay their development, impair their progress in school, impact their behavior, and change the course of their lives. Here in the city, about 10% of our children, testing is recommended by the state at ages 1 and 2. About 10% of children have elevated blood lead levels. And there's a long way to go then, because 1 in 10 is still way too many children who are experiencing elevated blood lead levels. But we're excited about the progress that we're making in ensuring that all children have access to lead testing. Jess will go into some of the roles that we play when a child is found to have elevated blood lead levels and the response that gets kicked into action. And increasingly, and a lot of this is being done in collaboration with community development, really excited about the progress that's being made in getting to the source of the problem. So if we're diagnosing children with elevated blood lead levels, we're diagnosing a problem. And getting to the source of the problem involves remediating those lead paint hazards, training people to do that, and really pushing this workforce forward to, again, tackle the source. So with that, I'll turn it over to Jess.
Thank you. Appreciate it, Dr. Anderson. So we have a bit of a hefty slideshow for you all. I'm going to do my best to cover everything in the time that we have. If you have any questions, just let me know. I can tend to talk about this a lot, so I tend to go higher level, and if you have more specific questions, just feel free to stop me. So we're going to plan to do an overview of our lead poisoning prevention team and healthy homes initiatives programs within the health department. I'll explain a lot about the HUD Lead Hazard Reduction Grant, which is run out of community development under Marty's supervision. We'll talk about our lead-free Onondaga investments and lead initiatives. And then we'll also do a very brief introduction to the New York State Department of Health's lead inspection rental registry that's coming up this year. Next slide, please. All right, so first, let's talk about the health department's lead poisoning prevention team. In a second, I'm gonna have you play a video. But what this video is gonna do, it's just gonna be a high-level overview of what this team does and all the different services and resources that are provided to the community with 3 main areas of focus. So we have our health and education outreach teams, we do surveillance and blood lead testing services, and then we also facilitate care coordination and family support. And we have a lot of key partnerships that go hand in hand with all of this work. So we're gonna try our luck at audio on this link. If you could click the blue text where it says lead poisoning prevention team. You might have to do a control click. Oh. I did test it last night. Not working? What if it comes out of presentation mode, will the link work or no? Oop, something flashed quickly. We'll run through it, we'll talk through it. We can circle back after and follow up with the video too. It does a great job of just describing everything that the team does and all the different areas of focus. Like I said, this is a lot of information, so it probably will be nice to have afterwards if you're thinking, wait, what was that she said? So if we could go to the next slide. Thank you, Ruthie. So health education and outreach. So this is probably the most visible thing in the community, I would say, across this team. So you might see we have some of our staff members here at a Head Start program during Lead Poisoning Prevention Week. This team really focuses on providing educational tips to prevent lead poisoning prevention in the community. We attend numerous events. We're available by request. A lot of times you'll see us involved with the Lead Safe Coalition of CNY. We coordinate a lot with Upstate Poison Center, and really the main goal is just to support and participate with the various service providers in the area and make sure that families are being made aware of the effects of lead poisoning prevention. We also partner with Syracuse City School District on various events and initiatives, which we'll get into a little bit later. And then this team is also responsible for promoting the other services that the health department has regarding home repairs, remediation services, and inspections and assessments of properties. So if families are looking for more information on how lead might impact their family or how it might be prevalent in their home, this team is responsible for sharing that information. Next slide, please. Okay. Blood lead testing services. So a lot of you might be aware that Onondaga County offers free blood lead testing. We do this both on-site and through our mobile testing unit, which we'll talk about in a little bit. A lot of people call it the lead van. You might have seen it around town. There's an interest form on our website. So if you are holding a community event and you're looking to have that testing vehicle at that event, you can reach out to our team. We can see if it's a good fit, if it's available on that day, and we can do lead screening at those events. So New York State Department of Health has requirements, which Dr. Anderson mentioned. So children are required to be tested by state law at ages 1 and 2. In the unfortunate event that a child has an elevated blood level, that'll be over 5 micrograms per deciliter, we are required by state law to run intervention through case management. So we'll reach out to that family, ensure that they are getting proper information. It's usually a very overwhelming time for the family, right? So either this is the first time the family's hearing about lead, they don't realize it's coming from their home environment, or maybe they're aware but repairs haven't been done on the property and now they've gotten to a point where, hey, my child needs intervention. So our testing team and our case managers are very well equipped at dealing with families who I would say are in crisis. With that, the higher the level, obviously the quicker the follow-up that's required. This is all set by New York State. And in addition, we also collaborate with primary care physicians. And you can see up here, so we'll get like 10,000 test results annually that we have to sift through and make sure that we're following the proper protocol for follow-ups for families. I think it's a commonly known fact that not every family has the privilege and access to a primary care physician, right? So ideally, primary care physicians are facilitating these tests at ages 1 and 2 to catch these elevated levels, but it's not always that a family has one. And if a doctor's office isn't in compliance, it's also on the health department to make sure that we're talking with that doctor's office and making sure that they're testing as required by the state. That's why we also offer free testing. So any families that are falling through the cracks can feel free to go to any of our testing services. The most popular way that we get the news out is through our Facebook page. You'll also see it on LinkedIn, county executives newsletter, and things of that nature. In the summer months, you'll see the van out and about a lot more. That's because we facilitate it's called a finger stick lead screening. So we have this device on the van and in our on-site testing pop-ups where you will test a child's blood lead level through using a finger stick. So a lot of people assume every test is done through venipuncture. The reason we do it this way is we do a preliminary screening. Obviously, they're following proper protocols, washing their hands first, making sure that there's no potential cross-contamination, right? We want to make sure it's coming from the child's bloodstream. From there, if in the unfortunate event that there's an elevated level, then that child is required to go and follow up through venipuncture. And the reason we do that is venipuncture is not really fun for anyone, right? So if we don't have to start with that as a first option, We don't want to do that until it's time to verify that the case is actually elevated or not. Right. Next slide, please. Thank you. Pre-K testing initiative. So some of you may have heard about this. In 2024, we actually, for the first time, I believe, in state history, we rolled out an initiative with Syracuse City School District to test all pre-K students. So as Dr. Anderson mentioned, children under the age of 6 are most at risk for lead exposure, and that lead exposure causing developmental issues and health problems along the way. So what we did was we partnered with Syracuse City School District as a response to the elevated water levels that were found to be in the schools. So I think, rightfully so, a reaction from that news was our kids being poisoned by the water in the schools, right? And so what we did was we said, let's be proactive, let's test pre-K students throughout all 18 schools. And so we did this in spring of 24, fall of 24, and spring of 25. 531 children were tested, so families, it was opt-in or opt-out. They were offered this service, and our team went out to each of these schools and facilitated testing. And you can see actually the numbers were really low. So it was about, oh, my math was wrong here. So the decimal point should be moved over one place. We can follow up with this slide after. I know I sent a corrected slide deck this morning, but it was probably too early or too late. So known elevated finger sticks at the time of testing, that means that we went in and we tested every child, whether we knew that they were tested or not. So some of these children, it was just an additional screening in addition to what they were already provided with their doctor's office. So some children we had case managers assigned to their cases, and then even less were confirmed as a brand new EBL, and we've completed follow-up with those families. So what we can, go ahead.
Sorry.
Yep.
What are the test properties of the finger stick? Is it pretty sensitive where it's able to pick up on the populations that we're concerned about? Are there concerns for false negatives, things like that?
My understanding of the test, and our team is here to correct me if I misspeak, but that it is quite sensitive, but there's actually more false positives, which is what you would want on a screening test, right? So say a kid had handled, I don't know, lead dust or something before, then that's why you need to clean the finger really well. But there are cases where you then follow up with the venipuncture and the child is not elevated. Did I get that right?
In terms of the device itself, it's comparable to laboratory analysis, but it's a lot more sensitive because you have to be sure that the testing protocol is incredibly on point with hand washing, cleaning of the finger, and that you maintain a sterile sample before it's tested on the finger.
Thank you.
Thank you. It's a good question. So, as I said, follow-up was completed with all of these families, and this really led us to believe, with such a low percentage of these children having elevated blood lead levels, that it's really their home environments or grandma's house or daycares. Lead-based paint is the primary cause of exposure. So go to the next slide, please. All right, so mentioned this a little bit, but we have a care coordination family support team. So as mentioned, it can be a scary time for families who are dealing with the unfortunate news that their child has an elevated blood lead level. So our team calls families, completes follow-up, provides educational material. We do have language line services, and we have some folks on our team who speak multiple languages because, as you're all aware, we have a very diverse community in the city, so we want to make sure that families aren't falling through the cracks with that information being provided to them. And then this team also coordinates heavily with our environmental team, who's in charge of inspecting the home environments and facilitating what we call an elevated lead level investigation across where the child spends the most time. Next slide, please. All right, lead safe healthy housing. So this is where we get into the more technical of what the inspectors do. So the inspectors at the health department are all EPA certified lead inspectors and risk assessors, and they do a surface by surface examination, if you will, of the house, right? That's the inspection and risk assessment. So they're going through the property, they're assessing where it's testing positive for lead. There's a couple different ways to do this. We use X-ray fluorescent devices. You might have heard of these. They're a bit costly. They scan through all the layers of paint. They give you on site a test result that says this is positive or negative for lead. As Dr. Anderson mentioned, I mean, mean, almost about 90% of the homes in Syracuse city limits are built before 1978, so you're usually finding lead in a home that you visit within the city. When it becomes a hazard is when it's a friction and impact surface, chipping, peeling paint, things of that nature. So they're looking to identify, okay, where is the lead? We're gonna run a report that shows you where it is, and then we're also going to do dust wipe testing. So you might have heard of this. This is when they take it, looks like a baby wipe, and there's certain protocols that the EPA guides inspectors on. And they go ahead and they wipe the area and they send it off to a lab for testing. We have a great partnership with some labs, so we're able to get quick turnaround times. So from there, these inspectors will also report back to the case management teams and lead and guide families to our funding and training resources, which we're gonna get into in a little bit. Next slide, please.
I have a question. For the fluorescent, you said?
XRF, we call them XRF devices.
Okay.
Yep.
For that device, is
Mhm.
it scanning, like, how does that, can you explain that to me a little bit? Like, does it x-ray an entire room at once or something? What are we doing?
So you're gonna hold it up to a surface and you're gonna press the trigger and it's gonna shoot the X-ray signals through the wall or the door frame, and then it's gonna generate a response. Tim, I don't wanna put you on the spot, but you just went through the training. Do you remember the technicalities and science behind it? We can follow.
You're gonna do a surface by surface inspection, so you're looking at, different components of a door, whether it be the stop, the frame, things like that. And again, as Jessica mentioned, you're gonna be looking for things in state of disrepair. As a risk assessor, that's something you'd be addressing.
The device itself, it looks like if you've been in the grocery store and you see the little thing where you're scanning the price on the shelf, it looks like that. It's a handheld device. You press it against the surface, you push it, and it reads through the paint to return a percentage of concentration of lead in paint. And if it's above the threshold that's allowed by federal and state regulation, it is considered a hazard and needs to be addressed by the owner.
So is it reading like, so I know what those look like, so is it reading a relatively small surface area at once?
Yeah, it's,
Whatever
well,
it's,
yeah,
whatever it's touching.
yeah.
And the surfaces that we're looking at is any surface that has any visible deterioration. It could be a chip, just a lot of chipping and peeling, or minimal. Health department standard is intact or non-intact. If we're seeing one pinhole in the wall, we're testing that wall.
And we'll get into this a little bit more, but Dr. Anderson mentioned exposure to paint. When I started to get into this work, I had the misconception of, it's children eating paint chips. They're picking paint off the walls, right? That's how they're getting poisoned. Not to say that that's not a way that they do get poisoned. I've actually heard lead-based paint is sweet to the taste. I haven't tried it myself. I do not recommend anyone doing so. But it's really those impact and friction surfaces that are painted with lead-based paint. So think about the old school built-in kitchen cabinets in a lot of these homes that have been painted over 1 million times. Windows and doors, you're opening, shutting them, they're not the new vinyl windows, so that's creating dust, and because the heaviness of lead, it settles on the ground. What do babies do? They crawl, they put their hands in their mouth, and that's really how they're most at risk of exposure. If we could give this video another go, I'd appreciate it. So this one's actually linked to YouTube, and I'm wondering if it might work. So some of you had the opportunity of hearing us speak last year. We did this year in review video. We are working on doing one for 2025, but the reason I wanted to show at least part of it today is because I think it does a really good job of providing an overview of all the different things that we do with our lead initiatives funding that we're still continuing to build on today. So more to come on a new video, but I wanted to at least show it here. It's also on our website, which I can guide us there if that would be easier with me.
If you take out that first part of the URL, it should work.
Yeah, if that video is a direct link, you should be able to just copy the.
Like, see the end part where it says the. Yep, oh, yep.
Well, if you don't mind, we can just do it quick. If you just Google Onondaga County Lead Initiatives. can't see what I'm
seeing
on this side. No, it's okay, you're fine. Oop, moves one up. Yeah, okay. No, we can, or actually you can access it from there if you click resources. Yep. And then if you see on the ribbon on the top, initiatives, right next to blood testing on the left. And then if it's not cooperating, we can just follow up after.
This also gives a nice opportunity to highlight the other resources we have on our website, right? So if folks are interested, they can access local data, they can see information on blood testing, how to request the use of the mobile blood testing vehicle, the schedule, things like that.
There it is right there. You should be able to just hit play. If the audio doesn't work, we'll just run with it. Doesn't seem like the audio is working. Okay. That's okay. I can go ahead and talk through it. I appreciate you trying. We can go back to the slide deck. Thanks, Ricky.
We can share these links with everyone as well.
It's okay.
Going back to the slides.
Yes. Cool. Yep. Okay. Next slide, please. All right. So how many of you have heard of the LED grant program in the community? It's pretty popular. Okay. So this is a grant program that's run out of community development. It has been run for decades successfully. It is catered towards properties within the county. Obviously, we know that we have the highest concentration of homes built before 1978 within city limits. It doesn't matter if individuals live in the city or live in the county, they're able to apply to this program. We are working on our 10th grant right now. It's the largest award that we've received to date. So eligible properties, there's a misconception that you have to own the property to apply for this. It's actually occupant based. So owner occupants are able to apply as well as renters. And the qualifying factors are that you must have a child under the age of 6 that lives in the home or visits frequently. So think about grandma's house or an in-home daycare, they're able to apply. And it's based on income. So it's 80% of the area median income is the threshold. And it's for 1 to 4 family homes. We do offer this to vacant properties, but they're not given priority just because we want to make sure that homes where children are residing and visiting most frequently are being served first. But if we reach a certain point where there's a vacant property, obviously that's a proactive means of preventing lead exposure. So we do it by a case-by-case basis. Let's go to the next slide, please. So here's some numbers. So as I mentioned, we were just awarded our most recent grant from Housing and Urban Development last year. We've already completed 39 units under that program. Our last grant, this runs on a 4-year grant cycle, we completed 240 units across the county. We already have 136 additional units in the pipeline to complete work with the goal, our benchmark is 270 by 2029. We're going to get into county investment in a little bit, but we've put in county budget dollars to support this grant. HUD sets a threshold for how much money you can spend on a grant or spend on a property, but given how old our housing stock is and how much work these properties need, a lot of times we exceed that threshold and we don't want to burden families by asking them to contribute, especially given that they are of lower income status. So we'll throw in county dollars to be able to help bridge that gap. And then additionally, if we end up going over the 270, we likely won't turn families away, given the investment that we have to be able to contribute towards. And there's just a map. This is on our website. You can zoom in and get in the grain a little bit more. But this just maps out the concentration of units that we've done. Next slide, please. Marty, did you have anything to add to the grant program before I moved on?
You're doing good.
All right, thanks. All right, so lead initiatives. You might have heard about this a lot. In my former role as the director of lead initiatives, we have Tim Pelly here with us today, who's taken that role on. So in 2022, for the first time in our county's history, we went ahead and we allocated funding specifically towards lead poisoning prevention efforts to go towards various initiatives in the community that our team executes. So in addition, through the American Rescue Plan funding, we had another $2 million that we used from that award to partner up with our county investment. And to date, we've contributed $13 million to this local effort. And county executive continues to commit to this annually. This is in addition to the existing funding that we've been administrating for years through our childhood lead poisoning prevention program funding from the state. It's a state grant. That's the bulk of what funds the lead poisoning prevention team, the HUD grant, and then we also receive funding from Housing and Community Renewal at the state. We'll get into that in a little bit. So since 2022, it's been $24 million allocated towards this work across all funding sources. Next slide, please. So when we talk about initiatives, there's 3 different areas that we really hone in on and focus. So that's workforce and remediation initiatives. I'm going to talk about this a little bit in depth. Please feel free to stop me at any point. Furthering existing program support. So we already have programs and resources that have been funded for years. How can we further them? And then special projects that arise. So what I spent the most time on, and what Tim continues to spend a ton of time on, is workforce development around lead. So contractor training and recruitment is something, if you've heard me talk ever, you've probably heard me talk about it a lot. When we came out of COVID, when we talk about our HUD grant and community development, for years they had a very successful pool of contractors. You know, we are 6 years out of COVID now-ish. We're still talking about its effects, right? And maybe not as much. But when we talk about being able to get into homes and complete inspections and have contractors go in there and do work, we had a significant amount of time where this work was put to a halt because of that, because of the pandemic. Coming out of COVID, we had a lot of contractors who had to catch up on private jobs, and there's more opportunities, right, to make money outside in the private sector. So we had a lot of work to do in 2021 and 2022 to build back that contractor pool and incentivize contractors to come and do work for the county. That led to long wait times for grant programs, right? So if you only have 5 contractors and you're required by HUD with your grant to do 250 units, you can imagine a family's waiting a bit of time for a contractor to free up to be able to start work at their home. So that was the condition that we were in 2022 when the funds came about for lead poisoning prevention through the county's budget. So we said, let's focus on the workforce. Let's work on contractor training and recruitment. It's expensive to get certificates from the EPA to take those trainings. And it's not always super clear how to be eligible for county work, right? Like, what's our bid process? What other, requirements are there for me to be on your pool? So we spent a lot of time hosting those classes monthly. All of that's on our website. I won't get too much in the grain on what each class is. And so we also facilitate technical support and assistance, back office assistance, things like that, to be able to take the required exams to be EPA certified. We're now up to 16 contractors in our pool since 2022. So I'll talk a little bit more about the impact of that in a little bit. Windows and Doors, you may have heard of this program. This is in partnership with the home headquarters. So this is catered towards rental properties in specific zip codes in the city that are identified as high risk. Landlords can apply to this program and they get their windows and doors, if they're approved, they get their windows and doors replaced at the property. Why just windows and doors? Friction and impact surfaces, right? So if we know the home's built before 1980, 1978, which, by the way, paint was banned in 1978, but if it was still on the shelves, it could still be sold. So that's why we tend to use 1980 when we're qualifying individuals for these programs. This program's been extremely successful. We've done it in partnership with the Community Foundation and with Home Headquarters for years. We piggybacked off of that, so I mentioned we get some funds from Housing and Community Renewal at the state. I'll get into that a little bit more, but we use Home Headquarters as a partner for what we're calling the Windows, Doors, and More program. This program has no income limitations for applicants. What is required is that there is an inspection and a known lead hazard as identified by the health department to trigger being able to be eligible for this program. So if our inspectors go in, they identify a hazard, the family might not qualify for the HUD grant due to income, we're able to say, hey, we have this alternative program that you can go ahead and apply for, and we're using Home Headquarters contractors, so we're not overburdening the HUD grant programs contractors. We do have contractors that work under both programs, but that diversity helps a bit. We also have a foster care home assistance program. Some of you might have heard about this, but our lead poisoning prevention team works closely with the Department of Family and Children's Services. So prior to a child being placed in a foster home, our team will go out and check the home for lead. This just ensures that we're placing children in a safe and healthy home. Sometimes when families go to apply to be a foster family, we do find lead, and fixes can be costly, but we don't want to prevent a child from a safe home. So what we'll do is we'll refer the property over to Marty's team at Community Development, and they will go essentially through the HUD grant, but because it's county dollars, we're able to waive the income requirements and things of that nature. So they go through a bit more of an expedited process for lead hazard reduction. And then I mentioned the HUD grant support before, so we use funding from the county's budget to be able to extend our impact for that program. Go ahead.
I have a few questions on a few of those.
Of course.
With the contractor training, you said you have 14 contractors.
Mhm.
Do you generally see them continuously taking on jobs, or are there some that are taking on most and a few that are kind of there?
If you wait a couple of minutes, I have
Okay.
a really cool graph I'll show you. That's a great question. Also, Marty's team runs through there's a bid process and they kind of rotate, right? So we're not sending it to the same 4 of the 16 every time, we're rotating through it. And we get responses from all. I mean, there's slow seasons, right? So a contractor might have an opportunity to work on a really big job. So we might not get him for a couple months, but then, a few months later, he's applying to everything. So it's nice to have that diversity.
Yeah.
Did that kind of answer
Yeah,
your
no,
question?
for sure.
Okay, anything else?
And then the Windows, Doors, and More is
Yeah.
kind of a question that I had earlier too. With
Okay.
If a child tests positive,
Mhm.
are we going in and able to remediate that home regardless of income and situation?
That is the point of Windows, Doors, and More, right? So the state, which is awesome, has said there's no income requirement for this program. And we're also able to do, I'm going to say, abatement adjacent work. So, right, we're not always doing a full gut job at a house, but the Windows, Doors, and More program is a lot more invasive. So it usually costs a lot more to do work in those homes.
So that funding is able to take on all of the associated.
Yes, and New York State also sets a threshold. It's a bit higher per unit of what we can spend, but we've been using county dollars to supplement and be able to fund the full project of those properties. Yep. So furthering existing program support, temporary relocation is something that our team's required to do. So in the unfortunate event that a child has a critical elevated level, say they've been hospitalized, they're undergoing chelation therapy, they're not able to go back to the home that caused these issues, right? So our team needs to make sure that it's a healthy and safe environment. Sometimes that looks like helping the family find a new home altogether to rent. Sometimes it looks like the family's going through one of the grant programs, they need somewhere to stay, and sometimes it looks like a landlord got EPA certified through us or not, and they can do the work themselves, and the family just needs to wait a little bit to go back to their home. So we cover costs associated with temporary relocation, think hotels, Airbnbs, temporary rentals, things like that. There's a lot of case management required there. So then our lead testing mobile unit is also something that county initiatives funded, so that's the lead van that you see out in the community. And then we have our general education program incentives, promotional items, things of that nature, staff support and training. And then special projects arise, right? So we mentioned the pre-K testing that kind of came as a result and a response to some news that came out. We wanted to make sure we were doing our due diligence and partnering with the City of Syracuse School District to screen children in pre-K programs. And then you may have also heard about the water filter distribution that happened over the holidays, not this past holiday season, the one before. So that was a response to a lot of fear and anxiety around water and whether it meant that children were being poisoned by water or not. So while the city was furthering research into that, we went ahead and we partnered with them to fund water filters that we distributed to the community. Next slide, please. All right, so here's some of the numbers when it comes to workforce and remediation initiatives. So on our website, you'll see all the different, how am I doing on time, by the way?
You have 20.
Okay, great. So we offer 3 different types of training. They're all on our website. We fund them free of charge for participants. So since 2023, we have funded 554 certificates. And I say certificates, not unique people, because with the different types of training, we have a 1-day training, we have a 2-day training, and a 3-day training. And so there's different requirements for the grant program. So when we think about recruitment, if we meet somebody in the 1-day training and they seem like they'd be a great resource to our grant program, their company could help us out, get some units done, we'll then put them through the 3-day training and they become a supervisor. We partner with Eco Testing. Daryl is his name. He's been great to work with. He actually helps community development with some of their lead testing over there. And we offer the 1-day class once a month. I can't think of a time we've had to cancel it because we haven't had interest. So the demand keeps showing. We keep seeing that there's a demand, so we keep offering it. The 3-day course is a bit more of a lift. So we do that quarterly. And then another thing to note is our main goal here, while we need to increase our contractor pool and we need to make sure that our contractors are using lead safe work practices on our grant programs, we're not turning individuals in Onondaga County away from this training if they're a landlord, property manager, or just anyone who's working on a home pre-1978, right? Because the ultimate goal here is to make sure that people who are working in these properties are protecting themselves and the occupants in these properties. So one of our main goals is to make sure that we're recruiting them for our grant programs, but we also see the immense value in just making sure that people know how to use safe work practices. So we've even had families who are handy and do home repairs and have kids, and they're like, I just want to make sure that I'm following safe work practices to take the class. Windows and Doors program, so this is what I mentioned earlier. We've replaced 826 windows in the community since 2024. Doors replaced 84, that's because we just do exterior doors through that program. Windows, Doors, and More, so that is the program that doesn't have the income requirement that we talked about in partnership with Home Headquarters. This is a pilot program. So we have the immense pleasure of getting on a call every once a month with other counties who are trying to figure this out, right? It's been amazing to work with the state on this program. They've been very flexible. They've allowed us to kind of bring feedback and morph the program according to county's feedback. So it's been a little slower going, but we're figuring it out and we're finding a great process. And the 5 units that have been completed so far through this program, to see the before and afters is just amazing, and to hear the families talk about their experience has been great. We have 48 additional units in that program, and we just received our 3rd round of funding from the state last week. And then I also mentioned the foster care lead hazard reduction assistance program. 7 units, we've been able to turn 7 units into foster homes as a result of that funding, and we have 5 more that are approved and in progress. Any questions yet?
So for some of these programs, how long, like when they kind of get on the list, how
Yep.
long does that take?
I got a slide coming up for you in a second. Yep, great question. Next one. Thank you. All right, so we talked about, perfect timing. We talked about the contractor pool. I'll have Ruthie in a second. I'll have you click that link. But in addition to increasing the contractor pool, went ahead and I did the numbers post-COVID, right? Just so you could kind of see the environment that we were in 2022 when we started funding this work. So we completed 125 units. That was through our old grant. From the time that a family applied to the program to the time that a contractor left their house, it took about 13 months on average. So just over a year. And to paint a picture of like what the process looks like, the front end of the grant program, timing is unavoidable, right? So a family applies, the application process itself can take a little bit of time just because family schedules, they need to provide their income information, we need to make sure we get a hold of them during work hours, they might be working, so there's some communication. Our team does great though with follow-up and proactivity with getting a hold of families. After an application is approved, one of community development's inspectors is assigned to the case. They need to do a surface-by-surface inspection at that property. And they work with Daryl from Eco Testing, who I mentioned earlier, to complete that. And then they need to write up a risk assessment report on the property. And then they need to turn it into contractor lingo, right? So they put together what's called a scope of work. That tells all the contractors in the pool exactly what needs to be done in a property in order to remediate the lead hazards. Per county and state requirements, we then have to put that scope of work out to bid for 3 weeks. So we have to give contractors 3 weeks to do their research on the scope of work, to go to the property, to assess if it's a property that they can handle. If they have time, they have to let us know an estimated start date. Then our office has about a week to review those bids and respond and award. So that itself can take a couple of months. Once we have a contractor assigned to the property, it's really just whenever they can start work. Windows and doors, I think the lead time on them right now is 6 to 8 weeks, right? So once they're awarded the contract and they sign with a homeowner. Also keep in mind, out-of-town landlords can be hard to get a hold of to sign documents. Then you have to wait for the materials to come in. Do you have a comment, Marty? Or no?
Then they have to be notarized as well, so that.
Yep.
When someone's out of town, we can try and do it in person as much as possible.
Yep.
If there are rehab inspectors,
Yep.
are notaries. So we take care of that problem, but when a landlord's somewhere else.
Yep.
That adds a little bit.
So given that front end, it's safe to give it about, it can go faster than 3 months, but it's safe to give it a couple of months, right? With new contractors and diversity and options of contractors, our new grant, we've completed 39 units since last year, and we're at an 8-month turnaround time. So we've cut it down significantly. My personal goal would be to get us to 6 months. I think it's achievable if we keep recruiting. But it's been great to see the impact that having additional contractors has. And our case management team at the health department partners with this grant. So if your family is waiting for work to be done, they're reaching out proactively and saying, here's lead safe cleaning practices in your house. If we're talking about those windows and doors opening, right, let's use wet wipes around every day, multiple times a day, things like that. So can you, Ruthie, please try to click that contractor pool?
I think that's been the remarkable thing about our approach, that we're not only training people, but we're training the people to
Yep.
train people.
Yes.
So there's potential for that
Yep.
exponential growth and the progress that we're seeing. So
Yep. Thank you.
it's great.
Yeah, so this is, it's kind of like an interactive graph that we have. If you scroll down just a little. These are our newest contractors since 2022. And so it's important to note too that community development runs other programs, not just the lead hazard reduction grant program. So these contractors aren't just eligible for the lead program, they're eligible for other county programs as well. So honestly, if you look towards the bottom, these are newer contractors who we just started working with, but this just shows the response rate. So when we're sending out those bids, who's responding, who's getting awarded. We have to go to the lowest bidder. In some cases, we are able, if we know that the child's at risk, the family really needs work done, and the second lowest bidder can start work tomorrow as opposed to 3 weeks from now. We can, on a case-by-case basis, see that critical need and make that judgment call. Dan, I know you had questions on this. Does this cover it?
Yeah.
Okay. Yeah.
So there's 16 there, is that right?
If you scroll down more, there should be more. I think 16 was the last count that I had. Does that add up? 1, 2,
Yes,
3.
no, it just, so, right, we went from 5, sorry,
No, I just wanted to say this is 16 in addition to those 5,
okay,
right? So these are the new folks.
these are the new
Yep.
folks, right? So we got a bunch of new folks and still the time, right? The time to completion. What about if how are we doing recruiting new folks more, right? So how's that going? Is there anything that can be done to motivate, incentivize folks? This has been a long time, and it's been a long time coming, and we're getting there. And it's really good. But is there something that we can do? I was involved with, I don't see him on here, but I thought he came all the way and went through, the and then these folks get the job, if we could talk about that, they get the job, they've got to be on the job. My concern is, in order to get through them quicker. And the way of, the life of a contractor, right? And any way to incentivize them, encourage them to move quicker, so that these folks can get back in there, can get it handled and get back to life, I guess.
So when you say get through it quicker, you mean the turnaround time at the unit,
Turnaround
correct?
time,
Right,
yeah.
so aside from, I mean, material orders are out of their control.
Right.
But what we've tried to do is, when we were working with 5 contractors at a time, we would allow them to work on multiple projects at once, because windows, they might be waiting for windows at this property, so let me get started at this property and wrap up a crew at this property, then we'll go back to the windows, right? And so it was efficient, but it also wasn't, okay, I have 3 weeks, I'm gonna be at this house for 3 weeks and I'm gonna knock it out, right? Now that we have this diversity, we're able to do that. In terms of continuing to recruit more contractors, that's primarily what Tim's been focusing on. A lot of it is hearsay in the community. We also partner with the Let's Safe CNY Coalition, the Contractor Training and Recruitment Subcommittee. Tim and I are the chairs of that committee, and so we have tons of community partners on that call that kind of sit around the table that are in workforce development, so that we're not recreating the wheel, and they're able to help us spread the word about these trainings. LinkedIn is big. We push it out. Our training's a lot on LinkedIn, Facebook pages. We did an initiative with the school district a couple of years ago at Nottingham and Fowler, because they have construction and electrical trade programs. So we offered some trainings to those students and tried to track, return on investment, see if the kids ended up getting into construction, things of that nature. And then Daryl, our trainer, has a close relationship with BOCES and SUNY EOC, so we've worked with them a bit. So yeah, we're pretty much hitting the gas still with offering the trainings. We also partner with our one-stop shop at the county to offer assistance with MWBE certifications, back office support. Some contractors are tech savvy, some aren't, right? So the EPA exams that are required to get certified require a resume, right? And so we'll have contractors come to us and say, I've been a contractor since I was 13, I've never had to do a resume. So we'll go ahead and we'll help them with that and through that process. So does that answer your question?
Yeah, it does.
Okay.
I think that from my past and history, right, this is very labor intensive, right? So people look at the numbers and say, wow. But what you're signing up for as a contractor can be just wild, right? So the homes that you're walking into that have this lead paint, once you get started with the remediation, right, it's like opening up a grab bag. You could get into all kinds of problems with the home itself as you try to fix it. Hence the thing, we just need more people. And it is in my opinion, this is a very complicated situation as we're trying to do our best to help people, right? Which is get it remediated and as quickly as we can. Then there's a contractor world, which is a limited pool. We're accepting the lowest bid for all the right reasons. But it's just instead of trying to get things done that we can, which would be try to incentivize contractors to come whatever way everybody thinks.
Yeah, and if I may, so just to continue off of that, so if you think about the trainings that we're offering, they're an EPA certified training, right? But what we're also doing in those trainings is we're asking Marty's team to come in and talk to the contractors about the process. I think a lot of contractors, rightfully so, maybe hear, ooh, like this is a lead grant program. Now, is the EPA gonna be watching me all the time? I have to use all these different procedures to make sure I'm using lead safe work practices and containment, and it can be intimidating, right? So in the class, we're trying to take that approach of, we're gonna teach you the content, but also what it's like to be on a county job site. And also our inspectors are assigned to those job sites, not to like pick on the contractors, but to say, hey, like that's probably not the right way to do that. Let me show you what our expectation is. And then they learn and grow through the process. So I think that's helped a little bit with the intimidation part. But you're right. I mean, I did a land bake house a few years ago and I got into that porch. I was like, wow. So when you think about siding and porches and basements and all of that, you never really know what to expect, especially with the old housing stock. So
And I really appreciate how you spelled out the different levels of certification as well. So you're minimizing barriers to entry on the lower end while simultaneously providing people a career path
Yep.
ladder
Yep.
to advance themselves and the work that they're able to accomplish. So I think one thing that we could explore would be incentives for people to continue along that
Yep.
ladder, for example.
Yeah.
And continue to invest in our workforce.
And you know, a contractor might end up spending, do the math really quick, maybe around $1,600 on EPA certifications if they have to pay out of pocket. But not only are they paying out of pocket, they're sitting in a classroom for 5 days away from a job site. If you're a supervisor, right, we have supervisors all the time, sorry, I gotta take this call, I gotta take this call, they're in and out of the class, right? It's a burden. So if we can at least relieve them of having to pay, but always open to hear if you think of any other incentives that we can roll out.
You
Yeah.
kind of, you may have covered my question
Mhm.
with those barriers that people are worried about with somebody looking over them.
Yep.
Is that why we, and I don't know any of these companies that I saw, we don't have some of the larger contractors that do like the windows, doors participating in, do we have larger?
So, when you say larger, do you mean like the window suppliers in the community that replace windows, like Excel Aluminum? Or?
I don't wanna mention any
Okay.
names, but just some of the like, window replacement or replacement people that people would know, maybe through
So-
advertising and things like that.
The thing about the grant program is it's not just windows and doors.
Yeah.
So we
Well,
tend to
they
not
kinda
work with
do-
those because they need to be able to do everything, right? They need to be able to do flooring if it comes up, painting if
Yeah.
it comes up, porches if they come up. Is that kind of what you're?
Well, I assume that these companies do because they're a larger.
I think they're required to. Like, if they come to your house and they find lead, they have to address it. Does that make sense?
Yeah, no, what I'm saying is that some people just may have more capacity in like larger companies.
Mhm.
I'm trying to
No,
not
it's okay.
say any names.
I just want to make sure I'm
You know.
understanding your question.
Yeah, so I would just think that there are large construction companies that are close that do individual single-family homes all the time.
Yep.
That may have a capacity to increase our capacity
Yeah.
significantly.
And if,
If we were to get a
It's
couple.
not enough money.
Yeah.
It just comes
Well,
down to money. It's not enough
like,
money.
Yeah, like if you're thinking of like a comfort windows,
Uh-oh.
they do everything. So, but to them, these jobs aren't something that they're gonna be overly interested in, because they're smaller jobs, they're not
Mhm.
as extravagant, and there's a lot required to meet the safety protocols to be able to do a lead job. So they make a lot more money a lot faster when they're just walking into your home and saying, you know, you wanna add on patio and put some siding on, that's great.
Okay.
I mean, if you know any, you can refer them to us. We can try to sell them. but-
So, because it's capped of how much they're gonna make,
Yeah,
And
and
'cause
it's not like they can do it volume, like they can with their other jobs.
Yeah.
You know, sort of a unit by unit basis.
isn't the average like 35,000, 40,000 for a home?
Less than that.
Is it like?
Per
The
unit?
windows, doors and more are more. But for an individual unit, for us to do, I guess we have a limit on how much we can spend with HUD money, but then we add in some, homes money is another grant that we run, and then we have county funding, so yes, they can get up into the 30 to 40.
And we do multi-units too, right? So we might be spending 80 grand on a property, but there's 2 units.
Yeah.
What are you
If I
saying?
could just interject too, so, with the trainings that we've recently had, we had a supervisor course, in the end of November, and then we had one in December. In working with, the team at Community Development, we have 7 new applications of contractors who have completed the training. So the third-party EPA test is extremely difficult. It has a high failure rate, because for a lot of contractors, it's, you know, they know the job, right? But it's a lot of HUD regulation, or EPA regulations and numbers and things like that they don't necessarily study. So we've been spending a lot more time. I've been working with Darrell, who Jessica mentioned as our trainer. And then I've been staying on top of them and working with Chris and Kristen over at Community Development. So we've got some new contractors. The thing to take into consideration with those programs too, though, is Community Development has to, they'll start them with a smaller job if they're a newer contractor. Some of the bigger names that we were not mentioning, of course, but that you'll see billboards with driving down 690, there are a few of those that do bid on some of those jobs. But as Marty said, that, you know, for them, a lot of times it's, they get in, they do, you know, they'll do a roof in 2 days. They're not coming in and putting up containment and doing a job that's taking 4 weeks because it just doesn't fit their business model. But we have 17 in the last supervisor course that we did in January. And I've already got 9 waiting to take the one we have in April. So we're actively helping them get through those. And then we do reimburse the cost for their initial testing, which is approximately $480. So.
And we're also trying to think of organic ways, right? Like we have very skilled, let's say, painters in our community, right? But they don't want to start their own business. They just want to paint for someone, right? And we also don't want to say, hey, like, we can vouch for this person 100%, you should take them on in your company, but we try to create environments where they can organically meet. So we do contractor breakfasts annually during Lead Poisoning Prevention Week. The Community Foundation and Lead Safe CNY Coalition help us fund a contractor networking and recruitment event. So that's at the end of October. Some of these contractors are actually a result of just meeting them at that event. So definitely would welcome helping promote that. Yeah, did you have?
Yeah, I was wondering, maybe you talked about this, but is there maybe like it seems like this would be a good opportunity to have like a pathway between the OCC program for a contractor?
Yep.
Do they do that?
That's on our list of people to reach out to make sure that we're able to offer. Yeah, that was a 2026 goal for us, was to have a connection there and start talking about it, because we could easily throw that into a construction curriculum. Like I said, we did it for the high school students. Soon, BOCES does it. SUNY EOC, we've done one for SUNY EOC. So yeah.
In terms of our elected bodies, one thing that you may not be aware of is some of the programs that train our contractors, the formal accredited programs at a university and community college, are not required to have any lead certification as a result of that coursework. So advocacy upstream, to perhaps have that as an added requirement in any certified academic program, would go a long way to increasing the workforce automatically.
Yes, so I have a couple of budget questions. So
Okay.
I know, like, so there was money from ARPA allocated to lead initiatives, but it says it's only about 50% complete, and you have to spend that money by the end of this year. Is there a goal to do that?
So it's a lot further along than
Yeah.
I can follow up with.
It is, okay.
It's very close to being
Yes.
Perfect.
Yeah.
So in total, it's very
Yeah.
close to be fully spent.
Okay.
When I don't have exactly off the top of my head, but it's very, very close.
Thank you. And then with the HUD money, so
Yeah.
we get federal dollars for this, is when we get those funding,
Mhm.
that just kind of rolls over until it's gone and then we apply again? Or
Yes, it's a 4-year grant cycle. So we have
Okay.
4 years to spend it, and then we apply again.
And then with the local dollars, you said we've
Correct.
allocated about $13 million.
Yep.
Do we know how much we've spent of that?
Christy and I can connect, and we can get back to you. The ARPA funds have helped us get a head start on everything, right? So, yeah.
Yeah, we definitely use the ARPA
Yeah.
funds first.
Yes.
That makes- well, that makes
Because
sense.
they
Because that
expire,
yeah.
right? So, yeah,
Don't
great.
quote me on it, but I think they're like $200,000.
Yeah.
Okay.
And they're spending with local, so we can
Yeah.
give you the exact dollar.
Thank you, that would be great.
Good questions, thank you.
Can I add just one piece to this? The interesting thing from all of this is when the local money was initially put into the budget, we brought the teams together from community development and health and said, you know, what are the most pressing problems? And clearly, lack of production or the ability to produce in a timely manner. In taking it now from 5 contractors now to 21 with even more coming, I mean, that was the most critical issue. And we had families upset, you know, what is taking so long? And I think being able to address that by asking our own teams, what are you
Yep.
seeing as the problem, is really what I think has made this really effective. We didn't, you know, prescribe from on high, what should we spend this money on? It was, tell us where the gaps are, where we are really running into issues. And, you know, I can't say enough about the work that they've done in partnership between the 2 departments and the teams themselves, about how far along this has come. So, you know, I know I'm not supposed to toot the horn, but I said.
It's been a lot of hard work. I think we have one more slide in the initial presentation, just something I want to touch on quick.
Is the
Yeah.
Lead Freedom House up and running?
Yeah, so we have, more updates coming on that soon. I know we announced that State of the County last year, so, you know, I'll save it. But yeah, more coming. It's very much still underway. All right, I just wanted to take a second. We don't need to do a super deep dive here. We're still waiting on some information from New York State, but it's something you might have heard about a little bit. So New York State Department of Health is requiring that local health departments administer a rental registry. This might sound familiar. Our Department of Code Enforcement has a rental registry that has a lead inspection component required to it. A lot of people just call it the lead ordinance. So essentially, New York State is requiring health departments to go out to 2 and up units in set zip codes. So we talk about high-risk areas a lot, right? New York State has given us these zip codes which correlate and overlap with the zip codes that we already know there's a high concentration of lead. And so what's gonna happen here is our health department inspectors are going to have to inspect painted surfaces and interior living units, common areas, and then also there's a bare soil component to these inspections as well. The nice thing about New York State is they gave us the windows, doors, and more funding as a proactive means to get into some of these units before this became a requirement. So we're still waiting on official guidance from New York State, but the new requirements are going to be in addition to the City of Syracuse's rental registry, lead ordinance, and we meet with the city team monthly now to start just discussing things of this nature. We also have access to their database, so we can go in and check and see if a home is active on a certificate of compliance or city rental registry. We can see if there's open lead violations from city codes, and we can coordinate with their teams accordingly. So more to come on this. I know it's just very surface level, but we're waiting to see the state's database, software, and learn about application process for homeowners. Once this rolls out and we have more information, we're gonna have open houses for landlords. I'm sure there's gonna be a lot of questions. People might be a little bit confused about the difference between this and the cities. And so we'll make sure we have the city team in the room as well to help answer questions.
I have a bunch of questions.
Okay.
So how are you gonna do compliance? You know, because the city can't do compliance. They got what, 30–40% compliance within their own municipality and the staff to do this. So what is the county's role in this?
Deb, do you want to talk a little bit about the county's role?
We're waiting for full implementation of the regs to be adopted, and one of the things that they're focusing on is enforcement of compliance. The model is slightly different than what our typical model is with SRF inspection, moving to notice of demand, and then progressing through our enforcement process. The rental registry is set up very similar to the city's rental registry, where it's visual assessment, industrial clearance. So of course, there will be a point at which a property owner has not met compliance for rental registry side, and they move into our routine XRF inspection and compliance workflow, which would include issuance of a notice of demand, potentially fines and fees, and other penalties that they may accumulate for non-compliance. But there's so many details that are yet finalized that some of those pieces are still a little vague to us. We're waiting for the formal guidelines to come out and then program guidelines for the health department to be a little bit clearer on what exactly the timeframe is for enforcement and how and when we have to deal with that. Initially, our first rollout is going to be with engaging with owners, talking with them, educating them, assisting with registration, and then talking through what's required to keep in compliance, so that when that visual assessment and clearance really takes place, owners are going to hopefully be more successful at passing that assessment and receiving the lead safety certificate.
Are they changing any laws about the compliance? Because you really don't have to comply. You know, they can't really force you to comply.
Can you expand on that?
In the city, I mean, they don't have compliance and they can't force them to comply to be on the rental registry for +2 units. Now, if you cross the threshold and I think it's 4 or 5, you got to see a vote on that. But yeah, I have to see a vote. But you know, they can't get them to comply. How are we going to get them?
It's a little bit different on the state side than it is on the city working side. The regulation is written for 2+ units to be required to comply with this requirement. As I said, some of the enforcement is still unfolding at the state level, and they're providing guidance to us, so we're waiting for a little more information on that.
And so we're going to have our own rental registry that has its own fee attached to it, I imagine.
At for dust wipe sampling for a health department-based inspection.
And we coordinated with the city at all, because we are gonna be taking this on. Is this something we can, take the burden or onus off of them?
We're already doing that. If an owner has had an inspection by both the city and the county completes dust wipe sampling and analysis for that owner, once their hazard and risk reviews and cleared by the health department, we're sharing the results of the dust wipe sampling with the city that meets compliance for their regulation. So there are owners that will proactively reach out to the health department and request an inspection from us so that they have access to that, because there is no fee for a dust wipe. If we inspect the property, we remain with the property until clearance and dust wipes, and at this point, there is no fee for that.
Legislator.
Folks with motion.
Just 1 minute, let's talk about this. Sorry. Anyone else on the committee have questions or anything that they want to address? This is your last slide.
I'm gonna open up questions.
Yes. I have a couple of questions.
Okay.
What about situations where there's a lead risk to a child that may not be within their unit or property?
Thank you for bringing that up. Yeah, sorry, is there more to that question or is
No,
that?
I think you understand what I'm
Yes,
asking.
no, I do.
Yeah.
So I mentioned the EBL, elevated blood level investigations, home assessments that happen, right? We know that lead-based paint is, without a doubt, causes the most lead poisoning in our community, but there are instances where there's other sources. So has anyone heard about the applesauce recalls, right? It's because of the cinnamon that was in the applesauce, right? So they actually found traces of lead in cinnamon. When we're going in homes, we're always starting with a surface-by-surface inspection of the property, but in the rare event that, there's no lead-based paint hazards here, it's gotta be coming from something else. They do a full investigation, painted toys, kitchenware, spices, things of that nature. So it's a full investigation. It is not just the property.
Well, what I'm thinking is like, if you're in an apartment building, it's in the hallway, it's not in your
Common
unit.
areas are part of
Or,
the
like,
investigation.
Houses are close together, the house next door is peeling.
Yep.
Is that house, the next door house, then eligible for funds to remediate if
I mean,
there's an exposure to the
our-
child next door?
I will say this, our staff is extremely competent and aware of the resources that exist. And I have had inspectors come back to my office and say, the house 2 doors down has chipping paint all over the driveway. Can I drop off an application, right? And so we can't force them to apply, but yes, if you suspect it's lead-based paint, you're not doing an inspection, you can't say it is, but you've been in this industry long enough, you suspect it's lead-based paint, definitely make sure that that neighbor is aware of our programs. Yep. Go ahead.
There's one piggyback answer to this. It's really important to stress that inspections just don't happen because a child has been exposed to them. We get referrals from our housing partners and our health partners all the time. An owner may call us and request an inspection, a tenant may call us and request an inspection. We do have some requirements for which properties we can and cannot inspect, and that's based on regulations that we work under. But we do inspections for a lot of different reasons. Rental registry is going to add to the volume of inspections that we do that are not necessarily linked to a child with an elevated hazard.
And then my other question is, I guess maybe both of you, but it might be for you. When we look at lead poisoning being a huge health risk in Onondaga County, where would you see the opportunity to continue to address that? In that the testing and the remediation, do we have so much remediation that we know about and are trying to address? Or is it that the testing, we need more testing to find out, to target that remediation? I'm just trying to think of which path this is going to help us to solve the health problem that we have.
So my
I
answer.
know all of it.
Yeah, no, that's a
For
good
sure.
question. But there's limited time, right? So
Yeah.
if we're gonna be strategic, where do we focus in? So using the testing as a sentinel for where our, the highest risk places where we need to go in that's a very unfortunate but helpful signal, right? To guide us to a place where we know a child is being exposed. I think getting to the source, testing wise, there's always more we can do. When we've looked at, for example, we went back and did a study of all children who were born, looking at birth certificates going forward to years 1 and 2, about 90% of those kids ultimately got testing, at least one test within the window that they should have gotten it, which is There's still gains to be made there, but 90% is reasonably good with a little more work to be doing. So always more we can do with testing. Ideally, that testing would be taking place in primary care offices, but as Deputy Commissioner Vinciguerra said, we know that not all children have access to primary care. So that needs to continue to be an emphasis for us. One area that I think we can be doing more in between diagnosing the problem, getting to the source of the problem, is education. So how can people safely clean their homes? Don't use a vacuum if you're cleaning up paint dust. Use wet wipes to clean that up so you're not aerosolizing it. Empowering families to be able to tackle paint hazards in their homes, knowing that most of our households in Syracuse have paint hazards. So that's one. Another is increasingly we're doing more with respect to what is healthy nutrition that can be preventive against lead poison. Because we know that things like iron, vitamin C, healthy nutrition can actually be protective against children to some degree as well. And we know that we live in an area that has food deserts and not all children have ready access. So there's things in between and along the way that we're also focusing on, but both are important on both ends.
I'll pass these out to you guys too. There's just some of our documents, informational tips and stuff like that that we hand out to the community that might follow up and answer some of the questions that you have right now.
I have a question. When you were talking about families going to temporary housing because of the housing remediation, what is the effort like for them to stay within the same area? Do they end up being able to stay in the
That's a
same area?
great question. Yeah, this is actually, our case managers spend a lot of time working with families to ask them what their needs are, right? Where do your children go to school? Do you have a car? Do you have pets, right? Things that you don't always think about. So they've been very creative and unique with very limited resources, I would say, in the community. Knock on wood, it seems to have always worked out anytime we run into one of these cases. And that's, I mean, I don't want to get too into it today, but that's one of the reasons that we're going to have a 4-unit property that families can go and stay at. That's pretty central in the city. More to come on that. It'll kind of be like an Airbnb style for those families. We recognize that if a family needs to be in a hotel for 3 weeks, we're grateful that we have a connection with a hotel, but it's not ideal, right? And so we've actually had a local landlord who has offered up a property that went through our HUD grant, who's allowed a family with 2 dogs to stay for a month while we did work on the Windows and Doors and More program, and it happened to be pretty much within the same neighborhood as the family. So we're always open to different options, and ideally it'd be nice to have in each quadrant of the city just some known place that's something that's not a hotel for families to go and stay.
Everybody good?
Yeah, and I know the rental registry, there's a lot of unknown there. Like I said, we will be having open houses, so as more develops, we'll be sure to make you aware.
Well, I appreciate you both coming and speaking to us on such an important issue, so
Yeah.
thank you for your time.
It's nice seeing everyone.
Marty, I know you were able to contribute significantly to this, but do you have more that you want to talk about specific to any of those grant programs?
No, I think that was pretty thorough. You know, the one thing I did want to throw out there, though, so people know, is that when the health department identifies a child with an elevated blood level, they refer them to us, and we immediately move them to the top of the queue.
Thank you, Marty.
So I just wanted to make sure everyone knows that, because that's an important component of the program.
Great. Oh, I'm sorry.
Yes.
Sure.
Is there any possibility to connect DSS payments to like the compliance piece? So I imagine a lot of the folks who are living in homes that are not complying with this rental registry and things like that are DSS funded homes. Is there a way for us to utilize that as a leverage mechanism?
We actually do utilize that as one of the sanctions that an owner may be subject to. So if there is at least one funded unit that is under violation from the health department and the owner is not in compliance with remediating the hazards, the rent is stopped by the health department. The city is made aware of that. Section 8 DSS are made aware of that. And in 2019, the county executive actually put forth a statement that any other units in that same structure, it's a 4-unit building, and we stop renting one, all of the rent, if they are publicly subsidized funds, is withheld from that owner. So there could be issues.
And then a follow-up to that, if those people find themselves displaced because of that, is there any assistance offered to them in that scenario?
We work with the families that are stopped, especially if it's a family that's receiving case management assistance from us. We're generally aware if they're under threat of eviction and how we might be able to support them, certainly by connecting them with other potential housing options. In some cases, arranging for emergency temporary stay until the situation can be resolved. But our case management team does a phenomenal job at that.
Thank you.
I'll just add on the positive side of all that as well. Our team's actively engaged in outreach to landlords, to property developers, and developing very positive collaborative relationships there as well. So there's been some proactive interest.
Thank you very much.
Yeah.
We can close this meeting
Thanks, everyone.
at
I
pending.
think there's still.
Oh, shoot. One more. We're not closing the meeting. Chairwoman Watts.
Alrighty. How is everybody? Hanging in there? I just have a quick thing here. I want to review regarding the outside boards and commissions related to this committee. So just a very brief reminder, we're looking to have committees review any appointments, both the ones that we are making as a legislature, as well as those who the county executive send over to us. And so we have matched each of those outside boards and commissions with one of our standing committees. And the ones here are predominantly going to be reviews of the county executive. The majority of the ones that are matched with Health and Human Services are appointed by the county executive, but then we will have legislature approval. So what that means is as he sends over those letters and such, then they'll be discussed here, voted on here, and then moved to session. However, there is one that is not the case, and that is the Cornell Cooperative Extension Association of the Onondaga County Board, and so we are looking to appoint Dan Romeo and Cody Kelly to that board. So I put forward that resolution to be able to appoint them, and I believe it's in your packet. I believe so.
Yes.
So if you want to go ahead and bring us to that vote. Any questions, concerns from you or not?
So
I think it's a great idea.
I'm glad he thinks it's a good idea.
So there's an item to move forward the appointment of Dave Romeo and Cody Kelly to the Cornell Cooperative Extension Board. Can I get a motion? Second by Legislator Burtis. All in favor? All right. Okay. The item will move forward.
Thank you.
Awesome.
The rest of them will be listed online, and so you can see the list on Basecamp of what they are. If you would like to look at what I have here as well, you can do that too, just to get a sense of what the current people sitting on the boards are and when those are expiring. That's all for now.
Thank you. I'll double check the agenda, and now we can. Thank you.